doubt I'm going to show you anything new or revolutionary for you. Here's the idea for protocols for this condition is we're basically trying to remove the hypertonicity in the muscles around the tissue that we're trying to help heal. And so very often less is more because we're trying to calm the nervous system in general. So if you're a person who likes to just dive right in and dig in, you know, this may be not saying any. It could be a little bit of a challenge. We're going to maybe have you dial some stuff back because just like Butler was saying, sometimes people do the nerve flossing and they go, nothing's happening, I don't feel anything. Kind of the same with this, some of this next stuff that we're going to do. It's subtle. We're trying to ease our way into the tissues rather than dive right in where we might normally go, well, those scalings are super tight, we really need to like jump in on this and do something. So we're just going to try to keep it moving. Okay? So the whole idea of working on the scalings, anterior and middle scalings is where our focus is to, again, just kind of reduce that pressure on the nerves bundle as it exits from the cervical spine. So interesting thing about scaling hypertonicity, you know, scalings are respiratory muscles, especially in that sort of panic breathing that we were practicing earlier. So if we can reduce scaling hypertonicity, it's going to allow the rib cage to drop a little bit and increase the space a little bit between the clavicle and the first rib. Right? That's a way to help reduce that costoclavicular entrapment. So I wanted to show you a picture. Mike Reinhold is a PT. He's got a ton of interesting info on the web. He works with a lot of baseball players. And so he just posted this last year or 2 years ago. I did not know this. Thoracic outlet syndrome in baseball pitchers is a thing. And one of his findings is that it's from hypertrophy of the scalings and the SCM muscle on the throwing side. So he took these photos, same person. Here's the line to show where the clavicles are on this picture. This is the left side, non-dominant side. Definitely a huge SCM muscle. I don't know if you can see. Here's a little bit of visualizing the scaling right here of the anterior scaling. But if you look on this side, actually on this side, his SCM, in this picture anyway, appears to be a little less hypertrophy, but he said it would be more. But here's this bulge of the anterior scaling down here as it comes down under the clavicle to attach on the rib. And here's the middle scaling. And here's where the brachial plexus would be right here, where that nerve is.
Just comparing left to right, but muscle tone, crazy difference.
Yeah.
Right and left. Yeah,
between right and left. Yeah. And yeah, even if you look further back, I mean, look at the traps here. Look at this upper trap.
Yeah.
This one,
It's definitely just.
So you can tell he's a right-handed baseball pitcher.
When we're explaining this as we're working on certain things, you know, as you're kind of working some of the areas, you'll feel a lot of times they'll feel tingling in their hand as we're getting this release. Things sort of come back online.
Right.
I want to make sure that I'm explaining that correctly to them. I'm not giving things that are inaccurate.
Right.
Oftentimes, the first thing the client's going to say is, "Oh, my hand just went numb," and I try to explain the difference between tingling and numbness. Numbness is going to be the absence of feeling.
Right.
If you're feeling tingling, that's a nerve and excited state. But that, so as we relieve that compression, you know, your brain is getting signals that it's not used to getting. It's trying to make sense of that. That tingling's kind of, as it starts to make sense of that, it'll. Do you understand what I mean? I want to have a good way of verbalizing that to clients as we're working on that. That you're not feeling numb, but we've freed up a nerve entrapment, and you know that. Yeah. What is that tingling, and what are you?
How do you explain it so they don't think you're hurting them, making it worse? Kind of like.
Well,
right.
Yeah, or just
so.
To convey what we're doing.
Generally, I think what you just were saying is you're on the right track. You're as you change the input from the nerve back up to the brain has to reinterpret what that feeling is about. So pain, numbness, tingling is a symptom of a condition, but that those sensations may temporarily come back as you reduce the compression on the throat as well, as more blood flow gets in there and it starts to report back to the brain in a different capacity.
Okay.
Yeah. Hopefully, when they're feeling that surge of sort of nerve impulse, they're also going to maybe feel some additional warmth. They're like, oh man, my hand is warm now. Oh, I can feel blood moving in my hands. So those would all be sort of positive adjuncts to the treatment.